Okay, so what I'm showing you guys today is going to be how to apply numbing after mapping without losing your shape. So the first key is making sure that your outline is dark, clean and crisp. Because the last thing, of course, is when we apply the topical numbing on top is you don't want it to smear, because that's basically the starting point to losing your shape. So I'm gonna go around my shape after I have it, and I'm just gonna go and darken up all these lines. I'm gonna do the same thing to this side. And I feel like it's already pretty crisp and dark, but I'm just gonna go over it again, especially with newer artists. I would suggest that you do this. It's super important as a newer artist because it gets very frustrating. You can become flustered, and most of you already spent about an hour on getting a shape to be symmetrical. So the last thing we need to do is, once we get to the final numbing step, is that we lose our shape. I like to do this first, do the mapping, and then do the numbing. That way our client is comfortable. So at this point, you can go ahead and start applying your numbing. What I like to teach my students is to use cotton rounds and some setting powder and just gently apply. So you can do this without this step, but for my newer students, I love to show them with this because a lot of the times your lines aren't as crisp and aren't as clean. But we'll go ahead and apply this. So then with a Q-tip, I grab my numbing on the cotton part, and I'm gonna place it in the center and just wipe it off. The reason I place it in the center is because I don't wanna smudge any of my mapping, any of my lines. And then I'm going to smear using the stick part. Never use the cotton, because cotton, of course, is used to wipe off. So I just smear using the stick. Really light pressure. I'm not even touching the skin. I'm like almost hovering. And then you can dab like so in order to just kind of spread it. And the amount of numbing I use is a very small amount. I'm gonna show you guys. I just fill up this cup. I fill up this little tiny cup, which I believe is a size 14 mm. And then I'll do the same to this eyebrow. I'll just kind of spread using the stick part, not the cotton. And then if you don't have enough, you can grab more from your numbing, but that was my whole cup. Or you can steal a little bit from whatever side has more and kind of just smear a thinner layer. Just like that, until the whole entire brow is covered. I still have some remaining on my cotton, so I'm just gonna kind of smear it off and then use that. And that's it, her entire brow is covered. Alexa, pause. I didn't realize, but the whole time I had that music blasting. And then I'm gonna take a piece of plastic cellophane, place it on, and not really pull it, because if you were to pull it, then we're gonna smear the mapping and our lines. We don't wanna do that. You wanna make sure that your client's able to open their eyes, because they're gonna be numbing for about 18 to 20 minutes. And if they need to get up and use the restroom, that they can. Also, just direct them that if they do move it, to let you know, so that they're not trying to like push it back up. The proper way to fix this, if it is to move at all, is to lift it completely up and then place it back down. And then we'll just go ahead and set up a timer for 18 minutes. And then after, I'll teach you guys how to take it off. Okay, so now that the timer has gone off, she's been numbing for about 18 minutes. I'm gonna go ahead and just remove it. And then this is the part where a lot of people struggle and they don't realize, like, you can keep your shape, okay? So the first thing I like to do is kind of put a little bit of stretch in their skin and pull their eyebrow up, so that I can use the stick, not in the cotton, because the cotton again is just gonna wipe it off. And I'm gonna put a firm and a firm pressure, and then I'm gonna pull. And then you can see that, like, here it is. This is all the numbing. I have 2 cotton rounds like on my procedure tray. For the first cotton round, I'm just gonna take it and I'm gonna kind of just twist it off and clean it up. And I'm gonna just keep it here. And I'm gonna do the same exact thing to the other side. Pull it up a little bit, put some firm pressure, and then pull all that numbing cream off. And I just like to wipe it off so that I can still use the same Q-tip. And then again, you can do one more time if you feel like there's still some, see? Wipe it off, come back again. You can use the other side if you need, and just get it all off. Okay, so then you're gonna use a clean cotton round. The cotton rounds that I like to buy is this side is a little bit more fuzzy, has a little bit more like lint and stuff, and this side's a little bit more smoother. I like to buy these ones, and I like to use the smooth side. So I'm gonna take my smooth side and I'm gonna just gently press and pull up, okay? Press and pull up. And what this is doing is helping me dry up the brows and get any leftover residue from the numbing cream. And boom, there it is. Her shape is still there. We're ready to go. If you are feeling like you need to clean it up, just take some of your tools and just clean it up so you don't get lost during the procedure. So I have my pencil here. I'm gonna go ahead and just darken up some of the lines so that I don't lose any of it as I'm going, okay? Clean it up just a little bit, so I know exactly where I'm going when I start the microblading procedure. But you can see it's very well still there.
Well, that's it for my video. I hope it helped. If you have questions, please leave it in the comments. Thank you for watching, and make sure to subscribe.